Good afternoon, and thank you for stopping by Across the Fence. I'm Keith Silva. A new effort is underway at UVM that will change how the university conducts its business, research, and how students will be taught. It's called the UVM Planetary Health Initiative. The goal of UVM's Planetary Health Initiative is nothing short of, as the organizers of this effort state, understanding that human health and human civilization depend on flourishing natural systems and the wise stewardship of those natural systems. In a minute, we'll talk to two of the leaders of this effort. First, a video produced by UVM Strategic Communications helps explain the size, scope, and profound impact UVM's Planetary Health Initiative hopes to have for both people and planet.
Planetary health. These two words capture the most pressing issues of our time. Together, they represent the understanding that human health and civilization depend on flourishing natural systems and the wise stewardship of those systems. They capture the fundamental truth of a cycle of interdependence. When our planetary systems thrive, we thrive. And when we are deliberate and mindful about our personal health, we also promote the health of the planet. Across the globe and here in Vermont, we are witnessing the consequences of a planet in distress. Climate change, deforestation, pollution, endangered species. These are not just environmental problems, they are human problems. From illness to mental health to food insecurity, the repercussions and challenges are real, immediate, and profound. The University of Vermont has a critical role to play in addressing these impacts. It is why we are committed to harnessing our collective strength through education, research, policy, and community engagement to lead the pursuit of planetary health. We are advancing research to understand links between human and environmental health in the context of a changing climate. We are expanding educational programs that emphasize the consequences of global planetary systems in distress. We are supporting policy by developing viable and economically sustainable science and technology-based solutions to our current health and environmental challenges. And we are engaging with communities to implement actions that help people and nature to thrive together. And with this commitment comes hope. Because together, with the brightest minds and committed global and local partners, we will chart a course toward a healthier future for both people and planet. The challenges before us are considerable and complex, but with ingenuity, dedication, and heart, the UVM Planetary Health Initiative is poised to meet them. This is our commitment, our mission, and our call to action.
Joining me to talk about the UVM Planetary Health Initiative is the interim president of the University of Vermont, Patricia Prelock, and also joining us is Taylor Ricketts, the director of the Gund Institute for Environment at the University of Vermont. Welcome to both of you.
Thank you, Keith.
Thanks a lot.
President Prelock, let's start with, we're used to talking about big concepts on our program regards agriculture, food, and the environment, but this one might be the biggest that we've had to tackle. Help explain this big idea in a way that can be understood.
Sure. It is a really big initiative, and when I think about it, Taylor and I have had these conversations several times, and what we're really looking at is the intersection or interconnection between human health and the health of the environment. So if I think about it, if I'm healthy, then it is likely that I'm going to help the environment be healthy because of the way I eat, how I work, the exercise that I do. And if the environment is healthy, then it's going to keep me healthy in terms of the air that I breathe, the food that I eat. So it's really the interconnection. And I think this initiative is really designed to educate our community, to do research that demonstrates the interconnection. And one thing that Taylor has been really clear with me about is that these are not separate things. We have to demonstrate how one is a kind of reciprocal of the other.
Taylor, interconnectedness seems to be the key. Is that, I'm not saying would you agree, but would you agree?
Yes, I'd absolutely agree. The video itself said for people and planet, and that's
Right.
a big rallying cry at UVM now. The point of this initiative is that those are connected. We're not working on people and then working over here on planet together.
Right.
We have to work on them at the same time in the interconnected way in which they are.
And speaking of the University of Vermont, this effort isn't some sort of ad campaign or some sort of way to sort of look at it. I love, you're already shaking your head at me. No, don't bother with the question, Silva. It's for real. This is how UVM is going to move forward.
Right. So I think, in my role as interim president, I'm asking myself the question, and when people bring proposals forward, for us to really walk the talk of planetary health, I mean, we have researchers who are doing amazing things, and I'm investing in research and education, but I want to make sure that we are answering the question, how is this going to contribute to our commitment to people and planet? And if it does, it will cause me to stop and say, is this where we want our investment, both for people and for financial resources?
And you're not just talking about big ideas from the Taylor Rickettses of the world. You're thinking about even small things, how things get recycled on campus, what kind of containers the cafeteria uses and things like that.
Exactly, our food systems, how do we compost? And knowing that a lot of the food that we make is wasted, how do we think about that differently to help those who are food insecure? So it's always about how do the two things work together? How can I keep myself healthy? And while I'm doing that, I'm keeping the environment healthy.
Right. Taylor, in some ways, I wrote this and you didn't correct me, so thank you. Your career has really been about planetary health, this interconnectedness, these two sort of systems working together in tandem. How did you bring this to UVM?
Yeah, you're right. My whole career has been about this, about the relationship between people and nature and the range of benefits that people get from nature. I spent a big chunk of my career, including when I arrived at UVM, trying to quantify those benefits economically in dollar terms. How much money is a forest worth? How much money are wetlands worth to protect downstream towns and things? What I've realized is that there's an even more powerful way to express how important ecosystems are to us, and that is through our health. The fact of the matter is, if we keep the natural systems of the world healthy, they will keep us healthy. And for people who are less motivated about money than they are about their own children's health, it's a much more powerful argument, and it's a much more personal one. So I've kind of migrated from economic frames and arguments to health frames and arguments, and find it even personally much more compelling.
And this idea of these two sort of people and planet, the interconnectedness, it's a concept and it's an idea that's been around about 10 years. Is it something that, are there other examples of this where you can say, yes, they're also doing this in X or Y?
Yeah, I guess I would say that this idea that our lives and health is intertwined with that of the planet is thousands of years old. Right? It's something that Western societies kind of forgot and are realizing now. So, but yeah, within the US and Europe and things, it's a relatively new idea to really see that these environmental things that we know we need to do, recycle, compost, eat well, actually rebounds directly to measurable health outcomes. We can measure the smaller need for health care, the better health outcomes for our children and things. So it's really this like fine point on bringing it back to our own health in a quantitative, really compelling way that I think is new, in the last 10 years or so.
President Prelock, I think you, as the head leader of UVM, you have to think about Vermont a lot. And I think there'd be a lot of Vermonters perhaps seeing this would be like, there they go again, UVM coming up with these big ideas, how does this relate to me? How does this relate to my family? What would you say to the people of Vermont when it comes to people and planet?
Well, for me, the Planetary Health Initiative is truly the ethos of Vermont. And so one of the things that I want to make sure that we do is this is not just something that is an ivory tower academic exercise, but actually we are going to support and work with the state of Vermont and some of the nonprofits and other businesses in terms of how do their business practices, whether it's farming or small business or tech how does what they do support the health of our humans and vice versa? And I think, one of the challenges that we've had is people are thinking, and I don't know if you were going to ask this question, but there's this climate anxiety and worry our kids have been raised with. We're destroying the planet, it's hopeless, etc. And this initiative is really how can a state come together and rethink how we're working together. And it's not about just having an electric car, which many people can't afford. There aren't enough charging stations. You live in a rural area where it's hard to find places. We haven't figured out how to dispose of the lithium batteries, but it might be that our faculty, staff, students, community members who can bicycle to work. And that is healthy for their heart and their own, they're out in nature, they're exercising, and it decreases the carbon emissions that we have. But for someone, for me, who lives in the islands, it might be, I'm going to do more of a plant-based diet and eat things that are good for me, that limit some of my meat intake, but then also I'm going to put back into the soil the compost that I do to grow my plants in the garden that I have. So the idea is that there are little things that each one of us can do to help our own health and the health of the planet. You don't have to buy something that you can't afford, but there are things that all of us could do collectively. And we have people looking at childhood asthma and pollution and what is the intersection. And
we have about a minute left. I quickly just want to get to exactly where you were going with this, which is that's your background. You come from a health background. You worked with autistic children for some time. Longtime viewers of Across the Fence would be like, I think I recognize her. This is something where very quickly you say, issues of autism can be helped with this Planetary Health Initiative.
Yeah, there's two pieces, one in diagnosis, one in intervention. We're now learning that there's an epigenetic connection, so you are predisposed potentially to have autism, and there are some environmental toxins that could increase the likelihood of those symptoms showing themselves. And the other, in terms of intervention, it's using non-pharmacological approaches like nature, walking, exercise, as opposed to drugs to decrease an autistic child's anxiety and stress. So there's lots of things I could talk to you about, but that's the connection.
Right, we are out of time. Thank you both very much. Always fun to speak to both of you. That takes care of our program for today. My thanks to the crew behind the scenes here at WCX who make our visits possible. I'm Keith Silva. Have a good one.